Welcome back to Weekly Neurology Deep Dive. Before we get started, I just want to mention that this episode is for educational purposes only. There's no commercial intent here. Today, we're rewinding the clock a bit with a flashback episode. We're going to explore a consensus statement on continuous EEG in critically ill adults and children. And we'll focus specifically on Part I, which looks at the indications for CCEG. Think of this as like a quick reference guide. But of course, for the full picture, you'll want to refer to the full paper for a comprehensive understanding.
It's a really valuable paper, especially for neurologists who need this kind of information at their fingertips for daily clinical decision-making.
So let's get right into it. What exactly is CCEG and why is it such a game changer in our field?
Well, CCED stands for Continuous Electroencephalogram, and it's basically a nonstop recording of the electrical activity happening in the brain. This continuous monitoring, often combined with video, gives us a window into the patient's neurological status. CCEG is particularly important in critical care settings because it helps us detect subtle brain injuries that we might miss with just a neurological exam.
So it's like having a constant stream of data revealing hidden issues that we might otherwise miss.
Exactly, and it's particularly powerful for identifying things like non-convulsive seizures and non-convulsive status epilepticus. These are seizures that don't have the typical outward physical movements we usually associate with seizures.
So they're like silent seizures. How common are these non-convulsive seizures, and when should we consider using CCEG to diagnose them?
The numbers are surprisingly high. Studies show that after a patient has a generalized convulsive seizure, up to 48% of them continue to have seizures that we can't see clinically. This is even after they seem to have recovered. And even more concerning, 14% of those patients are actually in non-convulsive status epilepticus. This means the seizures are either prolonged or recurring without the patient regaining consciousness. It's definitely a situation that needs immediate attention.
So even when a patient looks like they've recovered from a seizure, CCEEG is crucial to make sure there isn't any ongoing seizure activity.
Absolutely, and CCEG is important in other situations too. It's critical for cases of acute brain injury with altered mental status. Think of conditions like traumatic brain injury, subarachnoid hemorrhage, or encephalitis. These can all trigger seizures that are difficult to detect without CCEG.
The paper actually mentioned some pretty alarming statistics about non-convulsive seizures in these situations.
The numbers are definitely concerning. For example, in patients with an intraparenchymal hemorrhage, the occurrence of non-convulsive seizures can be anywhere from 11% to a startling 100% in children.
Wow, that's a huge range, so it seems like CCEG is really crucial in those cases.
Absolutely.
Are there any scenarios in the ICU where we should automatically consider CCEG, even if a patient hasn't had a history of seizures?
Definitely. One major red flag is unexplained fluctuating mental status. If a patient's mental state is up and down without a clear reason, CCEG can help figure out if seizures are the cause. CCEG has actually revealed non-convulsive seizures in 8–10% of coma cases where there was no prior history of seizures.
It seems like CCEG is essential for ruling out seizures as a factor in altered mental status.
Exactly. And we also need to pay attention to specific EEG patterns. If we see patterns like generalized periodic discharges or GPDs, lateralized periodic discharges, or LPDs, or burst suppression with intermittent periodic discharges, or BIPDs on a routine EEG, then we should strongly consider further investigation with CCEG.
So these patterns are like warning signs that tell us to dig a little deeper.
That's a good way to put it. They're not definitive proof of seizures, but they definitely raise a red flag. And we need to use CCEG to determine if seizures are actually happening.
What about patients who are paralyzed? Maybe because of therapeutic hypothermia or ECMO. How can we assess for seizures in those situations?
That's when CCEG becomes absolutely essential. We can't rely on physical signs of seizures if the patient can't move. So CCEG is our only way to monitor brain activity and detect seizures in these cases.
It seems like there are so many scenarios where just looking at a patient isn't enough. We could easily miss seizures.
That's right. And there are even situations involving unusual paroxysmal events. These are sudden, strange movements or behaviors that could be seizures, but they could also be something else entirely.
So how do we tell the difference between seizures and other events?
That's where video EEG comes in. By combining the continuous EEG recording with video, we can see what's happening in the brain and compare it to the patient's behavior. This helps us figure out if the strange events are actually seizures or something else, and it prevents us from giving anti-seizure medications unnecessarily.
It sounds like CCEG is a powerful tool for uncovering neurological problems that could fly under the radar in critically ill patients.
Exactly. It gives us a much deeper understanding of brain function in these patients, and it goes way beyond just seizure detection. But we've only just scratched the surface of what CCEG can do. We've talked about how CCEG is the gold standard for detecting those tricky, non-convulsive seizures. But it's not just about diagnosis. CCEG also helps us figure out how well our treatments are working.
So it guides our treatment strategies too.
Exactly. Let's say we have a patient in status epilepticus. We can use CCG to watch their brain activity in real time as we give them anti-seizure medications, especially those IV meds. We can see how the seizures respond to the treatment, and we can make changes based on what the CCEG is telling us.
So it's like having instant feedback on whether the treatment is working or not.
That's a great way to put it.
And it allows us to tailor the treatment for the best possible seizure control.
Exactly. The information we get from CCEG helps us make sure we're doing everything we can to get the patient's seizures under control. But the benefits of CCEG go even further. It can also be a very powerful tool for detecting cerebral ischemia.
That's really interesting. So we're talking about identifying areas of the brain that aren't getting enough blood flow. How does CCEG help us with that?
Well, when the brain is experiencing ischemia, the electrical activity changes in a predictable way. CCEG, especially when we use quantitative EEG analysis, can pick up on these subtle shifts in brain activity. And it can do this even before any permanent damage happens.
So it's like an early warning system for stroke or other conditions that affect blood flow to the brain?
You could say that. It gives us a heads up that something might be wrong, and it allows us to act quickly and potentially prevent a catastrophic event. But CCEG doesn't stop there. It can also be used to monitor sedation levels in patients who are in a coma.
That's fascinating. How does CCEG help us manage sedation?
This is really important for patients who are in a medically induced coma or are heavily sedated for other reasons. CCEG allows us to watch their brain activity and make sure it's adequately suppressed. But we don't want to overdo it with the sedation.
So we're trying to find that sweet spot where the patient is sedated enough but not too much.
Exactly. CCEG helps us walk that fine line and make sure we're providing the right amount of sedation for each patient. And if we look at the bigger picture, CCEG can even give us some insight into a patient's prognosis after a brain injury.
So it's not a crystal ball, but it can give us some clues about how likely they are to recover.
Right. Certain patterns that we see on the CCEG are associated with a better outlook, things like background continuity and reactivity to stimuli. On the other hand, patterns like an isoelectric EEG burst suppression or persistent seizures often suggest a less favorable prognosis.
So CCEG helps us understand the patient's chances of recovery, and that information is crucial for having conversations with families and planning long-term care.
Absolutely. It gives us the information we need to make informed decisions and set realistic expectations.
It sounds like CCEG is an incredibly valuable tool in neurocritical care. It helps us detect hidden seizures, monitor treatment effectiveness, identify ischemia-managed sedation, and even get a sense of the patient's prognosis.
I completely agree. And as technology continues to advance, CCEG is going to play an even bigger role in shaping the future of neurology.
Now that we've covered the reasons why we use CCEG, let's move on to the practical side of things. Part 2 of the consensus statement focuses on the technical considerations. The people, the equipment, and the procedures that are all essential for high-quality CCEG monitoring. Now let's dive into those technical aspects that are so crucial for implementing CCEG effectively. Part 2 of this consensus statement really lays out a clear roadmap, starting with the personnel involved. It really emphasizes that CCEG is a team effort. We need a skilled and coordinated group to make it work.
Absolutely. It takes a village, so to speak. We need highly trained neurodiagnostic technologists, or NDTs, working closely with the interpreting physicians, the electroencephalographers.
Yeah.
Each plays a vital role in ensuring we have accurate and reliable CCEG monitoring.
So the consensus statement outlines specific qualifications and responsibilities for each member of the team. Could you break down the key roles for us?
Sure, the neurodiagnostic technologists are really the backbone of any CCEG program. They handle everything from applying the electrodes, which can be tricky in an ICU environment, to recognizing artifacts in the recording. They can even identify some preliminary seizure patterns. They're the experts on the front lines, making sure the EEG data is top-notch and alerting the physicians to any urgent findings.
So they're essentially the guardians of the technical integrity of the CCEG recording, making sure everything's running smoothly and keeping the patient safe.
Exactly. Then we have the electroencephalographers, the physicians who specialize in EEG interpretation. Their expertise is essential for analyzing the CCEG data. They're the ones who spot those subtle abnormalities and make the diagnostic and treatment decisions based on what they see.
The consensus statement also goes into detail about the technical specs of the equipment. There's a whole checklist to make sure everything is up to par.
Right. The equipment we use for CCEG has to be reliable, accurate, and safe for use in the ICU. That includes the electrodes themselves, the EEG machine and amplifiers, the video recording setup, and the computer systems for storing and reviewing the data. Every piece of the puzzle has to work perfectly to give us a clear picture of the patient's brain activity.
The paper mentions the importance of using electrodes that are compatible with CT and MRI scans. Why is that so important?
Well, in the ICU, patients often need neuroimaging studies like CT scans or MRIs. If we use compatible electrodes, we don't have to remove and reapply them for those scans. That means fewer disruptions for the patient and less risk of complications.
It just makes things easier and safer for everyone.
Exactly. Another critical factor is the number of electrodes we use. The consensus statement recommends at least 16 electrodes placed according to the standard 10-20 system.
And why is that standardized placement so crucial?
That system ensures we're capturing activity from all across the brain. If we use fewer electrodes, we might miss something important, especially those subtle seizure patterns that can be so hard to spot.
So it's about maximizing our chances of finding those hidden problems.
Right. And we also need to remember to record signals from outside the brain, too. Things like EKG eye movements, muscle activity, and even breathing patterns. These extra signals give us valuable context and help us interpret the EEG findings more accurately.
So we're not just looking at the brain in isolation, we're integrating all these different physiological signals to understand the complete picture.
Exactly. It's like putting together a puzzle.
What about video recording? The consensus statement seems to put a lot of emphasis on that.
Video recording that's synchronized with the EEG is absolutely invaluable in CCEG monitoring. It allows us to see the connection between the electrical activity in the brain and the patient's behavior.
So we can see if those brain waves are actually producing any visible changes in the patient.
Exactly. It helps us confirm whether those seizures we're seeing on the EEG are actually having a clinical impact. And it helps us rule out artifacts caused by things like movements, external stimuli, or even problems with the equipment.
So the video recording gives us another layer of confidence in our interpretation.
Exactly. It's like having an extra set of eyes to double-check everything.
The consensus statement also talks about the importance of having clear procedures for every step of the CCEG process.
Those procedures are essential for a successful program. They ensure consistency, safety, and ultimately the best possible care for our patients. We need clear guidelines for everything from choosing the right patients for CCEG to initiating the monitoring, providing daily care, and even removing the electrodes.
So it's about standardizing the entire process to minimize errors and get the best outcomes.
Right. The consensus statement also emphasizes the importance of meticulous infection control practices. We're working with electrodes and preparing the scalp in a very vulnerable patient population, so we need to be extremely careful to minimize the risk of infection.
It's a good reminder that even the smallest details can have a big impact on patient safety.
Absolutely. One more thing I want to mention is the use of quantitative EEG or QEG. It's becoming increasingly important in CCEG monitoring.
What exactly is QEG, and how does it enhance CCEG?
QEEG uses computer algorithms to analyze the massive amounts of data that CCEG generates. It can detect subtle trends and patterns in brain activity that we might not be able to see with the naked eye. Even the most experienced electroencephalographers can benefit from this type of analysis.
So it's like having a computer assistant that's constantly scanning the data for us.
That's a good analogy. It's particularly useful for picking up on evolving seizures or those early signs of ischemia that we might otherwise miss.
So QEEG is another powerful tool that helps us interpret that complex CCEG data.
Exactly. And finally, the consensus statement talks about different models for monitoring CCEG. These range from continuous bedside observation by dedicated ICU staff to centralized monitoring systems. Centralized systems allow a team of experts to remotely monitor multiple patients at the same time.
So it's about finding the right balance between human expertise and technology. We need to make sure the CCEG data is being interpreted quickly and accurately.
Precisely. The goal is to have the CCEG under constant surveillance by experts, and to make sure any critical findings are immediately communicated to the clinical team.
This deep dive into the technical side of CCEG has been incredibly informative. It's clear that a well-coordinated team, reliable equipment, standardized procedures, and a commitment to continuous improvement are all essential for successful CCEG monitoring.
I couldn't agree more. And as technology advances, we can expect these technical aspects to become even more sophisticated and precise.
Well, that brings us to the end of our flashback episode on the indications for CCEG in critically ill adults and children. We've covered a lot of ground from the reasons why we use CCEG to the technical details making it work.
It's been a really comprehensive overview. I think it will be very helpful for neurologists who are dealing with these complex critical care cases.
Remember, this was just a brief look at the world of CCEGG. For a deeper dive, we encourage you to read the full consensus statement and really explore the nuances of this essential neurocritical care tool.
Continuous learning is key in our field. Stay curious and keep those brains engaged.
Until next time on Weekly Neurology Deep Dive.